Hi there, you're welcome to my YouTube channel. My name is Kofi. On today's episode of Did You Know, we'll be talking about alcoholism. Did you know the long-term health risk of alcoholism is associated with all the chronic diseases and the cancers you can possibly think of? This is really dangerous. Sit tight, relax, as I explain everything about alcoholism to you. Let's get this video started. You're welcome back. Alcoholism. Dependence on alcohol and development of related problems is a common and often unrecognized disorder. Alcoholism is often associated with many physical health problems. The greatest problem is the recognition and diagnosis of alcoholism, since affected individuals are often in denial of their problem. They underdeclare the amount and frequency of alcohol consumption and usually appear in hospital only with complications. The coexistence of other psychiatric illnesses like depression with alcoholism is also common. Now let's take a look at the causes of alcoholism. The first one is genetic factor. Most people are born into families with alcoholism. Therefore, the past generation's interest in alcohol tends to transcend into the current generation. The next point is familial and environmental factors. Most people say they depend on alcohol for comfort and also an assumed defense mechanism against their problems and their immediate challenges. Now, to the last and the most popular cause of alcoholism, which has to do with people who take in alcohol to boost their appetite. There are lots of people out there who cannot eat without taking alcohol, and the dependence on alcohol grows to the point where they can't live without it. Now, let's look at the symptoms of alcoholism. These symptoms may be observed by relatives or co-workers. The recurrent use of alcohol resulting in failure to fulfill major obligations at school, work, and home. Point 2. The recurrent use in situations where it is physically hazardous, example, driving. Point 3. The continued use despite having persistent or recurrent social, legal, or interpersonal problems caused by effects of alcohol. The next point, development of tolerance. People take alcohol to the point where they tolerate it and it's difficult to go without it. The next point, withdrawal syndromes. People get withdrawal syndromes when they are kept at places where alcohol is unavailable to them. The next point, taking increasingly larger amounts over longer periods of time. Because people take alcohol on a regular basis, they tend to get dissatisfied with the amount of alcohol they started with, and therefore depend on heavy amount of alcohol over a longer period of time than intended. Now, let's look at some of the signs of alcoholism. The first one is reddening of lips. This is called alcohol flash reaction, and it happens when your body is unable to fully digest all the alcohol you've consumed. This means that the toxins in your alcohol, including acetaldehyde, can build up in your body. In response, blood vessels in your face dilate, causing the redness on your lips and also on your face. The next point, smooth red palms. Excessive alcohol can make the palms red and swollen. These two traits are easily recognized when you shake someone's hand. This may have to do with chronic dehydration and imbalance of electrolytes in your body. To the next point, painless enlargement of the liver. Fatty liver is the buildup of fat inside the liver cells. It leads to an enlarged liver. It's the most common alcohol-induced liver problem. Alcohol hepatitis is an acute inflammation of the liver. There is death of the liver cells, often followed by permanent scarring. Alcohol cirrhosis is the destruction of the normal liver tissue. It leaves scar tissue in place of the working liver tissue. The next point, bruising on the skin. Heavy drinking can lead to easy bruising and bleeding, and not just because you are more prone to falling and hitting table corners when drunk. If you are regularly noticing unexplained bruising or bleeding, this may be a sign of excessive alcohol consumption for two reasons. Alcohol can harm your bone marrow and lead to a lower platelet count, which may result in easier breathing. Secondly, alcohol is a vasodilator that can cause your blood vessels to expand and rupture more easily upon light bumping. Now, to the last of many signs of alcoholism, stomach issues. Alcohol can irritate and thin your stomach lining, causing inflammation and alcoholic gastritis. This inflammation of your stomach's inner lining can lead to symptoms such as a nagging and burning ache in your stomach, frequent burping or hiccuping, feeling very bloated, which may worsen after you eat, loss of appetite, persistent pain in the upper part of your stomach, just below your ribs. Now, let's look at some of the investigations which could lead to the diagnosis of alcoholism. The first one is mean corpuscular volume, MCV. It is increased in majority of alcoholism patients. So when you go to the hospital, you might be asked to do a full blood count. The MCV is a parameter on the FBC report. Liver enzymes such as AST and ALT are often increased in alcoholics. Serum gamma glutamyl transferase (GGT) is also often increased in majority of alcoholics. Last but not least, ultrasound of the liver could give a clear indication and the health status of your liver. Now to the treatment. We mostly give the treatment to treat the complication and also achieve a total abstinence from alcohol use. Let's look at some of the non-pharmacological treatment. Most alcoholics will benefit from joining groups like Alcoholics Anonymous or religious organizations that encourage abstinence from alcohol. And mostly, adequate nutrition could go a long way to help you treat this condition. Thank you for listening to the end. I'm not saying you don't drink alcohol, but please drink responsibly. If you found this video informative, kindly share it to your family and friends and anyone you think might find this video informative. Thank you very much once again. Don't forget to subscribe to my YouTube channel if you haven't. Till we meet again, take a very good care of yourself and remember, you can also make a difference. Most importantly, don't forget Kofi loves you. Peace out.